Thank you. Thanks, JP, Derek, Ira, for organizing. It's great to be here. So we'll shift gears here a little bit and talk about a different kind of green. So my goals today or tonight are to really quickly go from big concepts and lofty ideas like sustainability all the way down now to a very small area or our area of sphere of influence as it relates to implants specifically for rotator cuff repair. Ultimately, I will try to convince you while the problems we face are large, it's not actually that hard to be green. So first, who cares? I know JP cares. He's been talking about value for a long time, and he's inspired a lot of us to do the same. Dr. Matson has also been a proponent and gave a great talk at the 2018 ASES meeting. It was actually the Ernest Codman lecture about consideration of these green techniques. I'd highly encourage everyone to view that if they haven't had the opportunity. And so Americans care too about these green concepts, and increasingly so. While there's still a partisan split, it's a rare issue where there's actually any type of majority opinion. People on both sides now believe climate change is happening. 8 out of 10 Americans believe it, that it's driving extremes in weather. That we also feel that the government's not doing enough, and particularly young Americans, including Republicans. So Americans do care and feel support for all the policies that are coming forth internationally, nationally, as well as locally. And even 95% of healthcare providers specifically see sustainability as morally necessary. So we do care. But why do we care? I mean, I think it's obvious as our way of life is at risk with global warming, it's increasingly difficult to ignore changes in the season, more severe weather events, fires, floods, droughts. And this also affects our health. There's an estimated loss of 470,000 daily adjusted life years from US healthcare related pollution. The World Health Organization characterizes climate change as the greatest risk to public health in this century. And because of healthcare itself, it's sort of a self-feeding cycle. The US in 2022, we were the second largest contributor to worldwide greenhouse gas emissions behind China. And per capita, the average US citizen is responsible for nearly twice as much climate pollution as the average Chinese citizen. So this green wave is coming, or it's already here, with 77% of people aiming to live a bit more sustainably. Healthcare is under pressure now to reduce its environmental impact. The medical industry specifically is a significant waste contributor and is lacking in a lot of sustainable interventions or solutions. So we see this internationally with the recent Dubai Climate Accord and unprecedented call to transition away from fossil fuels. We see it nationally, new EPA regulations, and even see it locally in my own counties and nationally in all kinds of different restaurants and institutions banning plastic goods. Specifically, plastics and single-use items are of growing concern. So the world and we continue to learn about these dangers in terms of living with and around plastics. We see these almost every day now, something new about how plastics affects our life. And critics have really called out uh, sort of a fraud over whether we can even do something about it or whether it's sustainable in any form. So let's quickly go from climate change in general to our own sphere of control with just a few facts. So U.S. healthcare produces more than 4 million tons of waste a year. We have 9% of all greenhouse gases are produced by the US healthcare system. 25% of hospital waste is directly from the operating room, from surgical procedures. And single-use plastics constitute 25% of all healthcare waste. And then using reusable products in the operating room can decrease OR waste by 65%. We also see this sort of green wave in our own publications. We see many of these are all after 2020, talking about reuse of equipment, operating room waste, and being environmentally sustainable. So just quickly to summarize some of these concepts that were talked about in these papers, there are many solutions ranging from reuse, refurbishing, repurposing, reducing. Reuse of product is one solution instead of single-use plastics and kits with each case. And there's technology now with various companies that provide this. There's companies that have gone away from anchors completely, and there's reusable versions of this. And we've had this for a long time, and several of our suture passers are exactly constructed this way. So many old products already work this way, and there's new technologies coming in terms of um, sterilization to reduce and remove blue wrap and improve on our ability to make use of reusable instrumentation. In terms of the carbon footprint, single-use devices were often the largest offenders, and switching to reusable items could reduce the footprint by more than 50%. In one case, University of Washington eliminated 5.8 tons of waste in a single year by reusing single-use devices. There's also significant ethical benefits. There's broader access for low-income areas. Principles of justice and beneficence are respected. And the financial benefits, $1.78 million were saved in a single year just by reusing undamaged drill bits, 200,000 just by reusing tourniquets. Reusing external fixators saved 32% in costs. But there are significant barriers to adoption, and these typically relate to concerns about patient safety, exposure to unknown liability risk. There's a lack of quality control metrics, helping people and institutions guide them on what's appropriate in terms of what can be reused and what cannot. So we care, it matters to us, but we often hear this is too big of a problem. I can't make a difference. So for that sentiment, I would submit to you, start where you are, use what you have, and do what you can. So we've talked a little bit about going from this large concept all the way to rotator cuff anchors, and we can measure this. The current pandemic in sports medicine is the reliance on these disposable instruments and the increased costs associated with it, storage issues, while being ultimately less sustainable. And again, it constitutes 25% of healthcare waste. So this work sought to directly compare the carbon footprint of waste disposal for single use versus reusable instrumentation for rotator cuff repair, specifically a cost analysis, looking at waste mass as well as waste management cost. Not surprising, the reusable system had the lowest total mass and the lowest total volume, which has implications for the front end for inventory size, as well as the back end in terms of waste disposal. So clearly the reusable system also had the lowest carbon emissions. And lastly, that translated to having the lowest medical waste costs. So for properly sorted medical waste, the cost can be 10 times as high for regulated waste. So anything that touches the medical surgical field. We also know that the specific system is safe and reliable with respect to outcomes without any difference in infection rates or to historic controls. So I thought we'd end and kind of go back to our sort of bigger ideas and being green. So what does this mean exactly? I don't really think it means you have to be an ardent environmentalist. Maybe you just don't like to waste. And we talked a lot about money already and compensation. I think we can all get behind that. But green is really about value and about value in some of those concepts that Dr. Matson introduced in just a very simple graph. But I would suggest that we need to consider a third dimension as it relates to sustainable innovations and techniques. We can still respect patient outcomes, achieve low costs, and still benefit our patients equally while also taking care of the environment. So if we consider the balance between society's interest, patient interest with our economic limitations, I think that's where value lives. But if we also consider humanity in general and our environment, that's really where sustainability lives. So we see a lot of companies continuing to pursue disposable instrumentation, lots of plastics waste. And, while that might be the majority, it doesn't mean it's the correct thing to do. So I would suggest it's really not that hard to be green. There's a lot of it going on already. You can just start within your own sphere of influence with a very small procedure. You can surround and align yourself with like-minded individuals, practices, industry partners. You can pick one area. If you're able to measure it, share the results, spread the word, and then repeat. So I like this proverb a lot, and I think it kind of summarizes what we're talking about. We don't need to lament about what wasn't done in the past, but we can simply start. Thank you.